Awareness Month, kailangan po nating pangalagaan ang ating mga kalusugan. At dito po sa Kababayan LA, we also need to talk about that. We have our guest this afternoon. She's a nurse practitioner. Her name is Kathleen Evangelista. Hello and welcome to Kababayan LA.
Thank you for having me.
And you're here to talk to us today about the top 3 gynecologic cancers affecting women, of course.
Yes.
And we'll start with the first one. What is the first one? What are the top 3 that we should be concerned about?
Top 3 to be concerned about would be breast cancer, ovarian cancer, and cervical cancer.
And in your practice, do you see a lot of Filipino women being affected by these cancer types?
Yes, actually we see a number of Filipino women who have various gynecological cancers, and we offer a lot of adjuvant therapies to aid in the treatment of cancer.
Okay, let's talk, for example, about breast cancer. Do we know already? I know that we still don't know what causes breast cancer really, but do we have an idea of maybe things we can avoid, foods that we can avoid maybe?
Actually, risk factors for breast cancer include family history, genetics, race, age, lack of childbearing, lack of breastfeeding, eating foods high in fat, alcohol consumption, and even obesity are a lot of the causes for this breast cancer.
When you say race, what's the race that's usually prone to this kind of disease?
Mostly Caucasian women, but we have found through research that breast cancer is actually the most common cancer in the Philippines now, and it is ranked as is the highest incidence rate in all of Asia, and 9th in the world today.
Okay. So. And what are the symptoms of breast cancer?
Some of the symptoms of breast cancer include a breast that feels abnormal from other parts of the breast tissue, having changes in breast size or shape, skin dimpling, nipple inversion, or spontaneous nipple discharge.
What about pain? Is pain usually a sign too of breast cancer?
Oftentimes patients do experience some pain with the changes in their breast.
Okay, so what do you think, what is the cure at Holtorf at your company?
The main thing about is to prevent the cancer from developing, so early screening is very important. Doing self-breast exams on a monthly basis, getting clinical breast exams on a yearly basis by a physician, getting mammograms done, ultrasounds, and MRIs.
So catching it early is key. What about prevention? Is there something we can do to prevent it from happening to us?
Again, it's a lot of, prevention is key in that you have to
take care of yourself.
Take care of yourself and get screening early.
Get screening early as well. Okay.
Yes.
The second type of cancer that we need to be informed of or be aware of is ovarian cancer.
Yes, ovarian cancer is actually considered a silent killer because symptoms don't usually develop until the disease has already progressed and advanced to the point where chances of cure or remission are very poor. The cause of ovarian cancer is unknown, and there's about more than 60% of women who actually walk around with stage 3-4 cancer already, where the cancer has already spread beyond the ovaries.
Okay, what can we do about that?
Again, early screening, getting pelvic exams done, physical exams, transvaginal ultrasounds.
Pap smear also yearly or regularly, right?
Pap smear more so for cervical cancer.
Okay, which is the third type of cancer that we need to be concerned about, cervical cancer. What causes cervical cancer?
Cervical cancer is caused by the human papillomavirus, also known as HPV. It is a very common virus that is easily transmitted through sexual intercourse, rubbing, skin-to-skin contact of the genital organs. And a lot of risk factors of cervical cancer include being sexually active at a very young age, having a high number of pregnancies, and being exposed to other sexually transmitted diseases.
And what's alarming about this is even if you use protection when you do have contact with another guy, as in sex, it doesn't help you as much, right?
Right.
You can still get it even if you're using protection.
Right. Wearing condoms actually does not prevent transmission.
Why? Why is that?
The virus is shed through the skin, so a lot of the skin-to-skin contact and rubbing of the genital organs, you'll be able to transmit the disease.
And I think bottom line is, she's been saying that over and over, early detection for any of these diseases. If we can put the website up, your website again?
HoltorfMedicalGroup.com, and actually HoltorfMed.com.
Okay, and that is based in Torrance. They do consult with people, and they do have different kinds of treatment for cancer. Thank you so much for sharing your expertise with us today. You were wonderful. Thank you
for having me.
Very informative. Magbabalik ko po ang Kababayan LA. Don't go away.
Celebrate ang LA 80s Harvest Moon Festival sa Linggo, September 19 sa Arcadia County Park at maka-enter